Morning, everyone. Welcome to the DEC press conference. My name's Nick Foley. I'm helping to manage today's event. We'll get underway very shortly, but I just wanted to give you a quick briefing on what to expect and a little bit of housekeeping too. So you will hear from 6 speakers during the press conference, 2 based in the UK. There's Salah Saeed, the DEC's Chief Executive, and Alexander Matteo from the British Red Cross. And then we'll hear from 4 overseas aid workers, including Dr. Louise Baxter from Save the Children, based in Bangladesh, Ahmed Khalif from Action Against Hunger, who's based in Kenya, but we'll be talking about the situation in Somalia, Farah Kabir from Action Aid in Bangladesh, and Muhsin Siddiqui from Oxfam in the Yemen. The press conference itself will last around 25 minutes and we'll then open up for questions at the end. We will finish at 10:45. We've got a hard stop there. Please post any questions you have using the chat box function below and let us know your name and publication when you ask a question. That would be really helpful. The panel will also be available after the press conference for one-to-one interviews. So if you would like to speak to any of them, we'd be very happy to book in a slot. If you could email us at pressconference@dec.org.uk. That's press conference, all one word, at dec.org.uk. We'll be really happy to sort that out for you. Finally, on housekeeping, please can everyone mute their microphones and turn off your cameras during the press conference. That just helps to avoid any background noises or distractions, as well as helping, of course, with broadband connections. Thank you. I'll now hand over to Salah to start the press conference. Oh, Salah, you're on mute.
Apologies. Thank you, Nick, and welcome everybody. I'm Salah Said, the Chief Executive of the Disasters Emergency Committee. The DEC unites the 14 leading humanitarian charities during times of overseas disaster, and we unite to raise funds quickly and effectively. Thank you for joining the launch of the DEC Coronavirus Appeal today. The appeal aims to support the world's most fragile states with the threat of the new deadly coronavirus. We rely on the tremendous support and the generosity of the UK public for our appeals. And I would also ask for your support and your help in getting the word out, please. Thank you. We've all seen here and witnessed the unprecedented suffering and the sacrifices that many of us up and down the UK have had to make during the coronavirus crisis. We've seen the dedication of the NHS staff and indeed the amazing work the NHS is doing. Never in our 57-year history as a DEC have we seen a simultaneous disaster both domestically and internationally. And we're now launching this appeal to target the most fragile states. Just imagine for a moment having to live in one of those fragile states where there isn't a national health service, little or no medical care, no safety net, having to flee your home, your job, leave everything behind, possibly ending up in overcrowded displacement camps or refugee camps with no running water and little or no food. And now suddenly having to face this new deadly and silent threat in COVID-19. So our appeal is targeting the most vulnerable and those weakened by years of war and instability in places across the Middle East such as Yemen and Syria, in Africa, Somalia, South Sudan and DRC, and in Asia, Afghanistan, and across Bangladesh, the world's largest refugee camp housing 850,000 Rohingya refugees. Shortly, you'll hear from our speakers and talking about those highest ranking fragile countries and talking more about the situation on the ground. Let me introduce you to our speakers. Alexander Matthew is Executive Director of International with the British Red Cross. From Nairobi, Ahmed Khalif is the Country Director for Action Against Hunger in Somalia. From Dhaka, Farah Kabir, Country Director for Action Aid Bangladesh. And from Sana'a, Yemen, Muhsin Siddiqui, Country Director for Oxfam in Yemen. Also in Dhaka, Dr. Louise Baxter, Senior Humanitarian Health Lead for Save the Children. Louisa is in Dhaka, but en route to the Rohingya refugee camps in Cox's Bazar. So let me hand over to our first speaker, Alexander. Over to you, Alexander.
Thank you very much and good morning, everybody. This DEC appeal is about what happens when COVID-19 meets the most vulnerable people in the world. From the beginning of the outbreak, aid agencies have underlined the pandemic will cause the worst damage and be hardest to contain where health systems are weakest. And they will be weakest in those countries where health systems have been destroyed, damaged, neglected, or never developed because of fragility, poverty, and conflict. Places such as Yemen, Syria, Afghanistan, and Somalia, as Saleh said, these are the contexts we're going to be talking about today. We will be talking not only about the pandemic itself, but the way that the pandemic has exacerbated crises that were already of major concern. People who were already food insecure now face a major hunger crisis. People who were already poor have lost the little income they had. People who were dependent on aid are no longer getting that aid. People who were at risk of domestic violence are now locked down with the people who threaten them. It is that connection between all these risks that we want to talk about today, the connection between humanitarian crises that were of major concern before COVID-19, the ways that the pandemic has made these crises worse, and the threat of the virus itself. The list of countries that we have chosen for this appeal could have been much longer. We could have taken a broader approach to the Horn of Africa. We could have highlighted the relationship between COVID-19 and the food security in Southern Africa. But to concentrate resources where needs are most extreme, we have selected a small number of countries where we think this connection between pre-existing crises, worsening conditions, and the threat of the virus have created the major humanitarian risks in the world today. Let's consider some examples. I was in Sana'a last year, and Yemen was already the major humanitarian crisis in the world at that point. Even before the conflict, Yemen was amongst the poorest and water-scarce countries on earth, but the conflict had made everything worse, of course. The ports, which were a lifeline in Yemen, had stopped functioning. Critical workers such as doctors, nurses, and water sanitation engineers stopped being paid. Gradually, the health system deteriorated until only half of the health facilities were still functioning. Lack of access to clean drinking water meant 2 million people had been infected by cholera. Displacement, lack of salaries, lack of investment meant most people could not afford the food that was available. And in 2019, this time last year, parts of the country were in or close to famine conditions. At its peak, our aid agencies were supporting over 10 million people with life-saving aid in Yemen last year. But now all of those conditions have got worse due to the effects of the pandemic. Remittances into Yemen, which were a lifeline for many families, have been reduced by 80%. The country's main export, oil, is producing less revenue. The currency has devalued, which given Yemen's dependency on import means pretty much everything has become more expensive. At the same time, the amount of aid going into Yemen has shrunk. The World Food Programme has reduced its food rations. The World Health Organization can critically no longer afford to pay many of the salaries for doctors and nurses. And COVID-19 itself is spreading. Information dissemination is very poor, so people with symptoms don't always know what they've got. They can easily confuse it with other respiratory diseases. Those around them don't have access to clean drinking water to protect themselves. And if you're sick enough and you think you do need to go to hospital, you may not be able to go because there's no fuel or the fuel is too expensive, or there may be no functioning health facilities nearby. And even if you get to a hospital, there is a high probability that there will not be the equipment, the beds, or the medicine that is necessary. That is why the World Health Organization has said that 1 in 4 people who contract or are diagnosed with COVID-19 in Yemen will die. We can see in Yemen that combination of pre-existing crises combined with new crises and the virus itself causing a major humanitarian risk. And Yemen is not the only place where we see this, as we'll talk about today. When I was in Syria earlier this year, the main concern was with the people of Idlib, who were trapped in a conflict zone, desperately in need of aid and without functioning health facilities. But even in the rest of the country, although the situation was perhaps a little less extreme, it was still critical, as deepening poverty is reducing or making it impossible for people to feed themselves and their families. And now this COVID-19, aid is reducing, remittances are reducing, the need for medical facilities is greater than ever, but they face the same issues. Some are destroyed, some don't have staff, and many don't have the equipment. So it's another example of the sort of triple hit of pre-COVID vulnerability, exacerbated vulnerabilities caused by COVID and the virus itself. That is what this appeal is about. And it's critical that the networks and partners of the DEC agencies all over the world are supported to, 1, disseminate information and to work with communities on how to stay as safe as possible throughout the pandemic. 2, engage in projects to increase access to clean drinking water. 3, support medical facilities with essential equipment and PPE kits. And 4, provide essential support to give people basic food security. This is an appeal that is, of course, driven by urgent humanitarian need, but it's also just good sense. We're not safe until we're all safe. The world is interconnected and we need to support each other through this crisis. Thank you.
Thank you, Alexander, in particular for sharing with us what clearly is a very disturbing situation in Yemen. We'll hear more from Yemen when we go to Mohsen in Sana'a. I wanted to also share with you how we talked very recently with a doctor in Yemen who told us due to the lack of PPE, sadly, they'd lost 5 doctors in the space of a few days in Aden, Yemen, which consequently meant that many of the hospitals and clinics had to close their doors simply because they didn't have the right equipment to help themselves or protect others. But let's now go to Nairobi and hear about Somalia. Ahmed in Nairobi, over to you.
Thank you, Saleh. I'll begin by saying that no country has been adequately prepared to deal with COVID-19 and the situation is much worse in fragile countries like Somalia. Somalia has the highest number of COVID-related cases in the region and deaths, I think, in Africa. But that's not the point. I think the issue is the COVID-19 is just an addition to the already burden that the country is faced. So the high rates of serious malnutrition, the low access to basic services, and the weak health systems formed a deadly combination in Somalia. And what our field teams see in the camps is that the cases are much higher than what is reported through the formal channels. We're also seeing people edging closer to a humanitarian catastrophe spurred by the spread of the COVID-19. The early evidence that we have seen in our health and nutrition facilities that we support is showing that the pandemic is also slowing other basic health services. And we anticipate an alarming rise in hunger and malnutrition levels among the most vulnerable communities we serve. If the current trend continues, child mortality could increase by an estimated 13% in Somalia alone. And it could be higher even if you combine the region. The country is already also faced with multiple simultaneous shocks that includes the desert locust, the effect of drought over the years, the conflict in parts of the country, and also the recent floodings, which is creating a perfect storm of humanitarian crisis. What we know in Somalia is it's a country that's just one step away from farming conditions. You only need one shock to go to the catastrophic level. Action Against Hunger is one of the major health actors that is treating patients with COVID-19 in Mogadishu and in other parts of the country, but also supporting the prevention efforts in multiple regions. This is a global health crisis, and the world must come together to help people who are most at risk. No one is safe until everyone is safe. Thank you.
Thank you, Ahmed, and good luck to you and your teams on the ground. I know the wonderful work that you're doing, and in particular with children, undernourished children in that part of the world. Now, let's hand over to Farah, who's in Dhaka. Farah?
Thank you, and good morning to everyone. We are in Bangladesh, which houses or which has given shelter to over 1 million Rohingya refugees. It's the largest refugee camp, and therefore we are so worried that coronavirus could spread like wildfire in the camps. When the camps are densely populated, if you would, to put it into perspective, it's like looking at New York City, but 1.5 times the population without the facilities. And the people in the Rohingyas are living in bamboo frames and plastic shelter with sanitation problems, with lack of running clean water. And in these circumstances, you can probably understand how difficult it is to talk about social distancing or to provide the facilities for testing and identifying the suspected cases. On top of that, there's lack of information, and the Rohingyas, as well as the host communities, don't have access to proper information, and they also don't trust the information that's been given. So there's this lack of trust, and they don't want to go for testing. So we've not been able to identify the actual number of cases, and we are in the middle of monsoon, and there is the constant threat of landslide. And in the camps where sanitation is already a problem, the virus could spread just in moments. So we are looking at issues of health, nutrition among the Rohingya refugees, but also the communities. And in these circumstances, as people are locked down, we find that gender-based violence has been in an increase. Women and girls are being receiving end of physical violence, mental violence, and they have nowhere to go. And this is why organizations like ActionAid and UN agencies are trying to provide women-friendly spaces. They're also engaging them in providing, making the masks so that at least some prevention, protection material can be given to them, because they don't have access to any of this. And in the present circumstances, where Bangladesh lacks medical support, doesn't have the facilities and the infrastructure or the personnel, the refugees are in double jeopardy. And we feel that all of us need to come together to support the Rohingya refugees, because if the Rohingya refugees are not safe, then the host communities in Cox's Bazar will not be safe, and all of Bangladesh will not be safe. So we really need the facilities, the support, and the involvement of the Rohingyas in protecting themselves, because they fear that if they are detected, they will be moved to an island which is flood prone, and they'll be isolated. So we all need to come together, to provide them with information and the hygiene material, as well as the medical facilities.
Thank you, Farah, and thank you in particular for highlighting the vulnerability of the Rohingya refugees, and in particular within that vulnerable group, how particular communities such as women and girls are extremely vulnerable to this crisis. Now let's go to Sana'a in Yemen and hear from Muhsin Siddiqui, who's the country director for Oxfam in Yemen. Muhsin, over to you.
Thank you, Salah. I think we all know that ravaged by more than 5 years of war, Yemen is already suffering the worst humanitarian crisis in the world. Coronavirus is now a crisis on top of a crisis for the people in Yemen. 20 million people, which is actually 2/3 of the total population, are severely hungry. 10 million are just one step away from famine-like situation. Only half of the health facilities are functional because the war has destroyed many of the health systems, and fighting continues. The economy is in free fall, and the closure of borders and supply routes has led to food shortage. Every day we see the price of food rising in the shops while people are getting poorer. Remittances have dropped by 80%, already my colleagues mentioned. For many families, this was the only thing to feed them. The first case of coronavirus case in Yemen was confirmed in April. Since then, the virus is spreading rapidly. Official number of cases about 1,500 with 425 deaths, but the actual figure is likely to be much higher because of under-reporting and a lack of testing facilities. UK government estimates the total number of cases might be as many as 1 million. Many of the measures to prevent the spread of COVID-19 are difficult or even impossible in Yemen. For instance, hand washing. 20 million people need water or hygiene assistance. When somebody does not have water to drink, how can they be expected to keep their hands clean? Social distancing is also a challenge for nearly 4 million people who have been forced to flee their homes due to the conflict. Often they are living in a cramped makeshift settlements without running water and nothing more than just some plastic sheets to shelter them. In one displacement camp in southern Yemen, I visited in mid-February. I have seen 7 family members living in just a tiny tent of 3 by 4 meter size. In such situation, social distancing just is not an option for most people. While 80% of the population are in need of humanitarian assistance, there is a real sense of despair and fear what coming months may bring for these people. They have lived through more than 5 years of conflict, endured famine and disease, and now face a deadly pandemic. A woman called Aisha from northern Yemen told my colleagues recently, coronavirus gives us 2 cruel choices: to stay home and die from hunger, or go out and die from disease. Abdul Hakim, one of Oxfam's paid community health volunteers, told us, you cannot imagine how desperate and people are. I can see them during the night, worried, sad, and totally unready to face another day. Having suffered so much, Yemenis urgently need help to face this new threat. Oxfam is responding to this crisis in Yemen through rehabilitating water system and network to provide access to clean water, distributing cash for food, working with the community health volunteers to educate people on coronavirus about hand washing and social distancing, and distributing PPE. Through our programs, we provided assistance to more than 2.5 million people last year. We are hoping to be able to do even more this year. Thank you.
Thank you, Masin. And again, disturbing to hear that Yemen, similar to Somalia, is only just one step away from famine, and the severity of the humanitarian crisis in those regions is really disturbing. And also recognizing that, sadly, that there's a huge lack of testing, which is painting a picture of low cases in places like Yemen and elsewhere. And this is not showing the true reality of the number of cases on the ground. Let's go now to our final speaker, Dr. Louisa Baxter in Dhaka. And I understand, Louisa, you're en route to the Cox's Bazar refugee camp.
I am, yes. Good afternoon from a very rainy Dakar. I must admit, I've written some notes which I may refer to. I only just got here, so I'm still a little bit jet lagged. And there's some really important things that I want to make sure that I say today. I'd also like to say thank you to my colleagues that have spoken previously. I was really impressed and deeply moved by some of the work that you're doing. And I think then just before I start, I'd also like to just take a moment to remember the victims of violence and conflict across the world. From the 15 mothers who died in the MSF clinic in Afghanistan 8 weeks ago, to George Floyd, to communities in Burkina Faso who are facing an escalation in conflict just this very evening. And when I began preparing this presentation, I wasn't sure what to say actually. And then I remembered 4 weeks ago, 2/3 of the world's population, so 5 billion people, were under some form of lockdown. So sheltering in place, protecting their families, their communities, themselves from a pandemic that really has taken us all by surprise with its speed and its ruthlessness, its ability to close schools, overwhelm hospitals, shut down airports. And I think that what coronavirus has done for me as a doctor is really remind me how terribly and wonderfully interconnected we are, and really expose the fault lines that the most vulnerable of us walk every day: the poor, the marginalized, those living in conflict zones, those undergoing food insecurity, Indigenous people, really the most dispossessed of people, and understanding how the cracks that they walk on are so thin. And, you know, I think particularly, for example, of children outbreaks. I'm here at the moment on my way to Cox's Bazar, but, you know, children in Beni, in our programs in Democratic Republic of Congo, who are facing a triple threat of measles, malaria, Ebola, and now coronavirus. And then to the pregnant women in our programs in Yemen who are saying to staff, I was willing to go to hospital to give birth, even though I was frightened of roadblocks and bullets. But coronavirus, what do we do? And, you know, our children in London who go to school and get one meal a day, and now school's closed. And yet, I think within this, there's a real incredible moment, I think, of, you know, of hope and opportunity, when across the world, I think we're seeing ourselves again as the vulnerable individuals that we are. And there's also a tremendous global call for justice and for challenging the structures that have separated us, be they socioeconomic, be they gender, be they racial. And that's why it's been such an inspiration for me to hear about, you know, what our field teams are doing, activities made possible by appeals such as this, which not only help us start coronavirus programs, but also allow us to keep our very essential services going, our food distributions, our vaccination programs. So, for example, you know, we have Congolese doctors who are taking the lessons learned from Ebola around how to distribute PPE, or how to check water quality, or reinforce health structures, prepare oxygen supplies, and taking that knowledge to Syrian refugees in Lebanese refugee camps, and how we've got, you know, in Yemen, we've got our midwives struggling to keep our maternity programs going, while at the same time trying to bring new sex and gender-based violence programs going for those women who are suffering violence within the home, something that we know has been hugely amplified by the pandemic. You know, women for whom home is a place of danger and terror. And, you know, here in Dakar today, I'm on my way to Cox's Bazar soon. And I'm just thinking, you know, I'll be working with my Bangladeshi colleagues, my Rohingya colleagues, who are our community health workers, a Canadian epidemiologist, a Dutch nurse. And they've really been working for the last 4 or 5 months to get our treatment centre open, which happened yesterday. And they spent that time working with the community to make sure water points are in the right place and that cloth masks are distributed. You know, understanding how to talk to the community to explain what coronavirus might do, to understand how the community want to be taken care of, how they want to live, and when we can't provide any further care, you know, how they want to die. And then I think about our programs in East Africa, where we're really doing some very innovative things actually as a result of coronavirus. We've developed a program where we can distribute masks, check water, and also check malnutrition in the same village for the same children. Something that technically we didn't know how to do before, but something that coronavirus has made us learn to do, and something that will take on, you know, long after it's gone. I think of also some of our really interesting programs that my education colleagues are working on, where we're understanding how to develop new remote tools for learning so that we don't leave a generation of children behind who will never go back to school. And I think, you know, with funding that, you know, that can be allocated from appeals like this, we can strengthen our work, for example, in Syria, which is a program very close to my heart, where we're working with children on their mental and psychosocial health, children that have fled conflict, multiple rounds of displacement, who now have to navigate the terror of what does coronavirus look like in their communities. And I say this is close to my heart because it makes me think of my 4-year-old niece, who said to me a few weeks ago, I'm afraid to go outside because if I do, I'll make, you know, all the old people ill with coronavirus and they'll die. And this is London. So money from appeals like this help us to keep programs going, to think about new ways to do measles vaccinations in South Sudan, and to support cash vouchers in Manchester, where I was born, in the UK. So when I think of these things, I think that we have a moment now to remember who we are to each other and who we want to be. To remember that what a child needs in Congo or Afghanistan, they also need in New York or London, and that what a mother is afraid of in Chicago or Yemen or Syria, they're also afraid of in Barcelona or Brazil. And I'd like to thank DEC for really launching this global call for what is in essence solidarity, and really reaffirm that Save the Children are committed with the partners to fight for children everywhere.
Thank you, Louisa. Thank you so much for sharing that with us. Okay, thank you to all our speakers, and huge thanks also to all the frontline aid workers and frontline health workers in those countries who are obviously putting themselves at risk in order to save and protect lives. So I'll switch now to Nick to help facilitate some questions. Nick.
Thanks, Salah. Yeah, I would just encourage people, if you would like to ask a question, to use the chat function. We have one in from Ellen Teague at the tablet. She asks, regarding Yemen, will the DEC speak out against conflict in Yemen and the British government's resumption of arms sales to Saudi Arabia, arms that could be used against civilians in Yemen?
Thank you, Ellen, for that question. Yemen is particularly close to me personally. I was born in Yemen, and I still have family and friends there. So I'm very, very familiar with the terrible and devastating situation in Yemen. And of course, everybody wants that war to come to an end. The misery and suffering the war is causing, and now COVID-19 is causing, is just hugely immense. there's no secret we want this war to finish. We want this war to end. We would urge all parties to the conflict, obviously, to put their arms aside and pay attention to the huge humanitarian crisis that's obviously unfolded in Yemen. However, our focus as a DEC, as an impartial and neutral organisation, is to maximise the funds in order to support and protect those victims of both the war and now COVID-19. Are there any further questions?
We haven't had any further questions in as yet, so if anyone would like to ask a question, please use the group chats. The other option is to use the raised hand function.
Perhaps whilst we're waiting for any further questions, just to recap in terms of what the appeal will actually do in terms of supporting communities. The first priority is really to provide families with clean water, soap, and information on keeping themselves safe. We've seen how here in the UK it's actually the most simple of measures that have kept people safe and protected people. And secondly, we want to provide families with enough food to prevent malnutrition, particularly amongst children. We've heard from Yemen and Somalia where they're only one step away from famine. And finally, and I guess critically, to provide frontline medical staff and aid workers with the equipment and supplies to care for the most vulnerable and sick. Thank you. If there are no further questions, we're happy to take some one-to-one interviews with any of our speakers. Just do pop your name and your outlet on the chat box or send us an email, and we'll be happy to arrange those over the course of this morning. Okay, so just wanted to draw this press conference to a close. But before I do, I wanted to announce, and delighted to announce, that the UK government will be matching the first 5 million donated by the UK public. So our thanks to the UK government. In your media packs and on the screen, you will see information about how the public can donate to the appeal. So anything you can share on this in your publications would be hugely appreciated. Again, thank you for your support. We do rely on the generous support of the public and your support to get the word out. Thank you very much. Goodbye. Thank you.